We are very, very grateful that he's made the time to be here in person today. He was going to send an avatar, but no. He's here. I'm sure, I know that he's equally delighted to be in Liverpool with so many NHS leaders and professionals from right across the country. What the Secretary of State is going to do, he's going to talk for about 15 minutes or so, and then he has granted us some time for some questions, which I've got some, and we'll use the Slido again. But without further ado, can I ask you to give a warm NHS welcome to the Secretary of State for Health and Social Care, Sajid Javid.
Good to see you. Thank you. Thank you very much, Victor. It's great to be with you all in person and to be part of this new format. The NHS Confederation has always had an awesome ability to bring people together, and this expo is an incredible example of just that. The last time I saw a crowd that was this big was very recently at the Platinum Jubilee. We came together that week to celebrate an institution we've all grown up with. And I think these kinds of moments matter because they make us look forward as well as back. Now, few can match Her Majesty the Queen's record of sacrifice and service, but the NHS, I think, can make a very fair claim. Like the monarchy, its success stems from continually reinventing itself for the times that we live in. In nearly 74 years, the NHS has reigned over the greatest uplift in health in British history, 50 of those years spent safely in Conservative hands. I knew you'd like that. It's true. I'm so proud to be the latest custodian of our health and social care system, working in partnership with Amanda too, who I think you'll agree has been a very real force for good. Later this month, I'll mark my first year in the job. It's just the blink of an eye, if you consider, of course, the history of the NHS. But it's already been a remarkable year. Our road map to recovery, Omicron and our fight back against it, and our COVID-19 elective recovery plan. There have been so many unprecedented achievements, of which you should all be fiercely proud. In just a short time, I've experienced more highs and lows than in any other job that I've had. I've had a few. Highs, like how we rose to meet the challenge of Omicron. Highs, like how so many of you moved mountains to run a remarkable booster campaign. Highs like how the social care workforce helped to safely reopen care homes so that family members could visit again. But the lows have been profound too. Like receiving Donna Ockerden's report on maternity findings in Shrewsbury and Telford. Like meeting heartbroken families bereaved by similar experiences in Nottingham. Or learning of the allegations about the North East Ambulance Service. My experiences of health and care are like so many other people across the country. We've all borne witness to phenomenal bravery and dedication, all while knowing things still need to get much, much better. It is possible to love the NHS and still demand change. There's no contradiction there. Like most of us, I watched that recent video from the Princess Alexandra Hospital in Harlow in the A&E ward. And I watched it with a mixture of emotions. There was horror, of course, at the thought that it could be me waiting in that A&E ward, it could be my children, your children. But also, there was respect. Respect for the colleague who had to deliver that very difficult message, and her poise in the face of unimaginable pressure. We all know that people working in health and care have one of the most difficult jobs in Britain today. So to her, and to everyone else working in health and care, I want to thank you for everything that you do in the most difficult of circumstances. And I'm under no illusion about the challenges that you face. Our COVID-19 recovery plan is ramping up to deliver a huge increase in activity, embedding new ways of working. Our new community diagnostic centres are bringing life-saving tests and checks and scans closer to people's homes. It's a vast effort that we should all be enormously proud of. Yet the scale of the challenge is equally vast. We know that some 11 to 13 million people, they stayed away from the NHS because of the pandemic. Many of those people are now rightly coming forward. We want them to come forward. Many of them are coming forward to A&E. Omicron was also a setback, with an additional some 16,000 COVID-positive patients in hospital. And we know that a number of people on waiting lists is continuing to grow. Not only that, but the COVID-19 backlog sits atop a broader set of generational challenges. Improved life expectancy is one of the great triumphs of the modern age, and in so many ways, an NHS triumph. But it also comes with its own challenges. The Resolution Foundation has projected that this decade is likely to see the fastest pace of aging in any decade from the 1960s to the 2040s. And as our population gets older, more and more people are living with increasingly complex long-term conditions. Treating an 80-year-old is 4 times more expensive than treating a 50-year-old. You know, at the start of this century, in 2000, health spending represented around 27% of day-to-day public spending. By 2024, that figure is set to rise to 44%. This government will always make sure that our health and care system has what it needs to face the future with confidence. We've put in record levels of funding in recent years, including raising billions more through the new NHS and social care levy, the Health and Social Care Levy. But funding will only ever be part of the answer. Growing health spending at double the rate of economic growth over the next decade, as I've heard some propose, is neither sustainable, desirable, or necessary. I don't want my children, anyone's children, to grow up in a country where more than half of public spending is taken up by healthcare, at the expense of everything else from education to housing. That's not a fair deal for the British people, particularly young people. Obviously, we face many structural challenges, from an aging population and multiple long-term conditions. But demanding that spending growth of this kind suggests that we will fail to reduce demand through prevention or early diagnosis and more effective care, as well as fail to increase health and care productivity with improved use of capital and skills and management and data and innovative models of care. I refuse to countenance such failures. I know that when it comes to improving productivity and quality over the next decade, there's no one more ambitious than you. Indeed, it's one of the 4 key objectives that Matthew set out at this conference, which I very much welcome. You know, and when reports came out of the Cabinet last week, where this report said that I described the NHS as blockbuster in the age of Netflix, it caused a bit of a stir. But it's because I believe in the NHS and its founding principles that I want to focus minds on why some organisations keep pace while others get left behind. Before entering Parliament, I had the privilege to live and work around the world. And I can tell you, the NHS is unique. It's not there to make a profit, and it never will be. But it's also not immune to the same basic choices that face organizations, as particularly large, complex organizations right across the world. We need to be smarter with our capital, digitize and transform our use of data. We need to grow the workforce, improve leadership and management, and prevent problems from escalating in the first place. We need to accelerate the development of new, innovative models of care and build a more personalized service in a way that people now come to expect. Can you imagine any multinational without access to levers like workforce planning? Or think of a big supermarket chain without a consistent leadership and management program? Or any FTSE 100 company with its digital functions outside of its own organization? I believe there are a great many things that we can still do before we even think to turning to taxpayers again. And it was great to hear from Amanda just now about making the best use of every pound of taxpayers' money. Together with all of you here today, a lot of this work is already underway. Let's just take a quick look at some of the things we've worked on in the last year alone. We've built new institutions like the UK HSA and OHID to redefine how we do public health in this country. We've strengthened existing institutions like NHSE itself by bringing workforce and digital transformation into the heart of the NHS. We've announced how we will improve the provision of social care, something successive governments have done for far too long. We set out ambitious public targets to slash the long waiting lists over the coming years through the COVID-19 elective recovery plan. And we're on trajectory to meet the first of those targets next month. We've published an integration white paper, a blueprint of how we provide better care for patients and better value for taxpayer. And in March, in a speech at the RCP, I laid out the building blocks of our future, the 4 Ps around prevention, personalization, performance, and people. I did note Amanda's 4 Rs earlier today, which I also very much agree with. And on Monday, I announced our new data strategy called Data Saves Lives, to bridge the digital divides between health and social care and to ensure that we use people's data safely and responsibly for their benefit. And next month, the bulk of the new Health and Social Care Act comes into force, including the now statutory ICSs. It's certainly not been a quiet year in my first year on the job, but I've been determined to keep moving forward because this moment in time, we dare not lose. It's a moment when we can combine valuable lessons from the pandemic with incredible new technology and innovative ways of working, which, when taken together, they help us face the challenges of the future. It's a small window in time where we can make a big difference. For me, an important recent moment was when General Sir Gordon Messenger and Dame Linda Pollard published their landmark review into health and social care leadership. I remember Gordon saying, and I quote, "For a report like this to really have an impact, it has to be supportive and honest." And I think we can all agree that's what we got. And I'm pleased it has been welcomed by the NHS Confederation, by NHS providers, and many more. I'm very grateful to Gordon and Linda for their work, and I'm pleased to accept their recommendations in full. They found countless examples of great leadership, not just at the top, but at all levels of the NHS. And more than that, they found great leadership under considerable stress. They found that where there's better leaders, there's also better teams. And where there's better teams, of course, there's better outcomes for patients. I've seen this for myself. in countless visits across the country, including the one just this morning to Royal Liverpool University Hospital. But this kind of exceptional leadership isn't embedded everywhere. The review has had some really important insights. First on collaboration. We know that for years, people have worked tirelessly to do the right thing for patients, doing their best to work across the walls that have kept things apart. The walls between health and care, for example. The walls between neighboring trusts. The walls between one organization and another. We've chipped away at these walls for a while now. And through the pandemic, we sent whole sections of these walls crumbling down. For instance, the incredible way that we rolled out the vaccine, the incredible job the NHS did. No one wants the walls to go back up. So now we're bringing more of them down. From the changes to the NHS to the new ICBs, colleagues can collaborate as never before. Implementing the recommendations of the review will support more collaborative leadership, one where we're working across divides where the walls once stood and embracing, you could call it a connection culture. I was also moved by the insights on culture in the workplace. They found, and I quote the report, too many reports to ignore of poor behavior, and that we've reached a point in some parts of the system where bullying and discrimination are, and I quote, almost normalized. All of us know from our own careers just how toxic this can be. Because when even just a tiny minority behave in that way, it can be contagious for behavior and morale. We will have zero tolerance on discrimination, bullying, and blame cultures. And that, of course, includes racism, as was highlighted by the BMA's report just today. We know that if you tolerate this kind of behavior, it doesn't just make health and care a worse place to work, it makes our country a worse place to live. The examples of Shrewsbury and Telford and Midstaffs and shows us the extremes where this behavior can take us. Standards not being met, complaints being ignored, lives needlessly lost. So let me be clear. The actions of the few should take nothing away from the values of the many. In fact, it's because of the incredible professionalism of the overwhelming majority of colleagues in health and care that we should even be more determined to get this right. And the good news is this. Just as Gordon and Linda found that bad behavior was contagious, they found that great leadership was contagious too. It works best when everyone, even those without the word leader in their job title, feels like a leader. Other recommendations around training and standards and management will support this effort, helping the workforce at all levels by creating the conditions for everyone to thrive. And when I say everyone, I mean everyone everywhere. Not just those in leafy pockets of England, but where people need it most. We know that in some regions, poor leadership is a constant challenge, and that's an injustice that we're just not prepared to tolerate. We need the very best people to be in the hardest jobs, and getting the right leaders in the right places takes the right incentives. You know, when I first took up this job, one of the first reports I read was the excellent work our CMO, Sir Chris Whitty, had done on the health and social challenges around our coastal communities. And I've seen them firsthand. That's one of the reasons I did my first speech as Secretary of State in Blackpool on health disparities. And it's why when I was recently in Clacton as part of my Road to Recovery tour, where I chose to go to Clacton because I'd read and heard about some of the challenges there, including how Clacton has the second highest mental health need of anywhere in the country. So I make no apologies for encouraging top talent to areas facing the biggest challenges and the biggest problems, especially to some of our most deprived communities. I'm committed to making these changes, to supporting the leadership our colleagues in the NHS and social care deserve, and the leadership everyone, everywhere deserves. Now, the year ahead promises to be no less busy. We'll shortly be publishing our digital health and care plan, our health disparities white paper, our 10-year plans for cancer, dementia, and mental health, our update of the NHS long-term plan after COVID, the HEE workforce framework, which later in the year will be followed by the NHS's first ever 15-year workforce strategy. I also recognize that primary care is going to be a crucial part of the puzzle. It's the front door of health and care, and I'm grateful to all primary care staff who make a difference to millions of people every single day. But I don't think our current model of primary care is working. That won't be a surprise to you. I know, you know, and I think patients know, and everyone working in primary care knows, we need a plan for change. We're starting with pharmacy, but I will be setting out my plan shortly. And I'm also very grateful to Dr. Claire Fuller for her recent review on how we can improve patient access to primary care. I'm confident that her recommendations will improve access, including for those with the most complex needs, and ultimately help to tackle the COVID backlog and help people live healthier lives for longer. I'm determined that when we look back on these years, on this window of change that we have right now, that we can say we did all we could to secure the future of health and care for the generations that will come after us. And so today, I also want to focus on one more thing our new Health and Care Act can help us achieve. The pressure of the pandemic produced some powerful partnerships. With the ingenuity of the people on the front line, including so many of you, walls that had seemed so rigid came tumbling down. As we face the challenges of recovery, those ways of working can work again. You know, back at the RCP in March, when I made that speech, I talked about the potential of what I called partnerships for reform. Now, we have a legislative framework that encourages it. For the ICSs to fulfill their full potential and make the changes truly worthwhile, I want to see the creation of many more of these reform partnerships. This is already happening. We've already taken forward the provider collaborative model, where a group of providers of acute or mental health services can agree to work together to improve the care pathways of their local population. For example, there are currently some 47 NHS-led provider collaboratives for mental health, learning disabilities, and autism. We've seen the success of this approach in London, where the South London Health and Community Partnership has been able to bring out-of-area patients down by 1/3 and readmissions down by 2/3. There are also some 50 acute trust collaboratives and mixed collaboratives, bringing together acute and specialist and mental health and community providers. So it's about listening to the innovators already doing incredible things within the system, and then giving them a platform to do it. They've already shown that when we partner like this, challenges that appear intractable in one place can be resolved in another. These partnerships work. Most of all, they deliver for patients, and they're helping us to tackle the COVID backlog. So for me, the logical next step is to think about how we can use these kinds of partnerships to support underperforming trusts. You know, earlier I talked about using incentives to get the right leaders into the right places, places that have been let down for too long. Reform partnerships will be a central way we can spread good leadership to those good places. So, as part of the work on reform partnerships, I want to explore whether we make being part of a reform partnership a requirement for underperforming trusts. I believe that this could be a powerful way to ensure that the leadership we need doesn't stay in the walled gardens of England's best performing trusts, but it's there to help turn trusts round, and with it, the health and happiness of the people who live there. So, I'm looking forward to working with all of you on these plans. I know you faced and that you continue to face the most unimaginable of pressures, and you continue to do so with passion and innovation. You have not just my admiration, but my full support. I'm proud to work with you and to call you my colleagues. Because if there's a theme that unites all of this work, it's this: that the ideas and the ways of working we need are already here with so many of you in this room today. I believe that we can continue to reinvent ourselves for the times that we live in, for this institution that we've all grown up with to be the one that we grow old with dignity and with good health. And the moment to do this is now. We have no time to lose. We have a small window of time to make a big difference. Let's keep breaking down the walls between us to meet the challenges before us, so that together we can deliver better health and care for everyone, everywhere. Thank you all very much.
Thank you, Secretary of State. Fantastic speech.